good morning and welcome back to Momentum. We are currently live with you on Facebook Live as well as right here. We are talking about beware. COVID-19 is still out there. That is the topic for today on this beautiful Monday morning on the 1st of August. It is Health on TRAXX. Today we are talking to Dr. Wan Muhammad Zainol Zakaria, who is a Principal Assistant Director with the Division of Disease Control with the Ministry of Health. Good morning, Doctor.
Hi, good morning and Assalamualaikum to all of you. Dr. Wan.
Dr. Wan. All right, Dr. Wan, let's talk about the questions today. Now, the current situation of COVID-19, it is getting kind of serious again. So could you tell us more about the current situation?
Okay, guys, let me remind you all that COVID-19 is still out there. Even though nowadays our SOP is slightly loose, but the COVID-19 is out there. If you can see from the graph by the Ministry of Health Malaysia, there is a slightly increasing in trend COVID-19 cases since July this year. But obviously it's not as severe compared to the previous years when our country was badly affected by the Omicron variant or by the Delta variant. But with now, currently, there is a slightly increasing trend. But fortunately, the number of death cases and also hospital admission is not as many as compared to last time. And that is still under control. But if you can see from the graph, it's still increasing in trend.
All right, Doctor, and like for average, we are looking at an average of 3,000 cases almost every day. Like only yesterday, we saw a slight dip, which dropped it to about 2,000 plus. And right now,
our
go on, Doctor.
country is still reported thousands of cases. It's still high.
Yep, absolutely. Thousands of cases per day is quite high. Now, let's talk about the COVID-19 effect. The COVID-19 affects our respiratory system. Is there much difference between a person affected by COVID-19 in 2021 and currently?
Okay, let me recap you all with the mechanism of this disease transmission. COVID-19 transmitted through airborne. It transmitted through the air. So anyone with COVID-19 can spread the disease with air droplet, respiratory droplets. And if you can see from the statistic, with the current trend of COVID-19 cases in our country, obviously the number of deaths is quite low. If you can see from the report, averagely, every week our death cases only recorded less than 10 cases per day. And the hospital admission cases also is not very high. And the ICU utilization also is not very high as compared to previous time, especially during the Delta variant, KG. If you can see, during the Delta variant, I think from June until September last year, 2021, our country was devastated by COVID-19, where the number of death cases is very high.
Absolutely.
Our hospital, our healthcare facility is being overwhelmed by these COVID-19 cases. And most of the people lost their loved ones during that time. You can see with the viral videos and all that.
Absolutely.
So based on this data, clearly stated that the severity of COVID-19 has slightly low compared to the previous time. And we are grateful with our rapid vaccination program, COVID-19, which implemented by Ministry of Health Malaysia. Obviously, with this data, with these facts, COVID-19 vaccination really helps Ministry of Health Malaysia, our country, in curbing COVID-19 disease in this country.
Yeah, absolutely. And also based on the vaccination rates and also the fact that some of us are being asked to go on for the fourth vaccination. Now, Doctor, tell us who is at risk of getting this disease?
Obviously, people who are at risk of getting this disease, if we mention about getting this disease, is the population, the productive age group. The young people, especially who are always going out for works, always met people involved in the social activities, because this virus spread through airborne, through the air. So if you are always meeting people, not comply with the SOP, definitely the risk of getting the disease is higher. But if we talk about the risk of getting severe disease, as obviously elderly people, more than 50 to 60 years old, with comorbidities, with immunocompromised condition like cancer, chronic diseases, and also young children, less than 5 years old, young baby, all these individual is high risk to get severe disease of COVID-19. Therefore, I recommend all of this group of people, if you are not vaccinated, you are not getting vaccine, please get the vaccine immediately lah, to protect yourself, especially these high risk group individuals from getting severe COVID-19 disease lah.
And of course, the ones who are older with the comorbidities, and also the ones who are younger who haven't gotten their vaccines yet. Now, Doctor, we'll be taking a very, very short break, song break, and once we come back, there's more to talk about right here on TRAXX. Right, so today we are talking to Dr. Wan Muhammad Zainol Zakaria, who is the Principal Assistant Director, Division of Disease Control, Ministry of Health. We are talking about beware, COVID-19 still out there right now. We've got a couple of songs coming your way. Don't go anywhere.
Be inspired, informed, and up to date. Tune in to TRAXX Momentum interview feature of the day at 11:15 a.m. Join us as we speak to our panel of guests on various topics. Health on TRAXX on Monday. Tuesday, Spectrum. Wednesday, What Matters? Face to face with our guests on Thursdays. And on Friday, tune in to W Talk. TRAXX Momentum, Monday to Friday, 10 a.m. to 2 p.m. only on TRAXXfm.
The Pussycat Dolls are Don't Ya, right? Don't you know that COVID-19 is still out there? That is the topic for today. Beware, COVID-19 is still out there. We are talking to Dr. Wan Muhammad Zainol Zakaria, the Principal Assistant Director of the Division of Disease Control, Ministry of Health. Welcome back, Doctor.
Hi, welcome, KJ.
All right, Doctor, could you tell us more about the health protocol? Should there anyone who is not sure what to do if they believe that they are COVID-19 positive?
Okay, now Ministry of Health always emphasize regarding the self-empowerment, meaning the people itself out there need to look up themselves also. We are implementing the three strategies. The three that are always being promoted by Ministry of Health, Facebook, and also website. The three stand for certain component. Let me brief you all, explain you all what is exactly is the trees. The trees meaning that the first component is the test. The T stands for the test. So all of the individual out there, if you are having signs and symptoms of COVID-19, I'm sure all of you out there are very familiar with the signs and symptoms of COVID-19 because we are already living with the virus almost 3 years, KG?
Yeah, absolutely, Doctor.
Yeah, almost 3 years because before this, we only depend on government for aggressive measures to control COVID-19, but now we emphasize on the self-empowerment. For the test, you need to do self-test. Nowadays, most of the COVID-19 tests can be purchased from supermarket and then from the pharmacies. And the price now is quite cheap. Less than 10 ringgit also you can get the COVID-19 test. But make sure the COVID-19 test is approved by KKM if you are doing the self-test. And then after doing the self-test, you need to self-report yourself if you are positive through MySejahtera application. Always bear in mind that MySejahtera application is still applicable. Do not uninstall MySejahtera apps from your phone because nowadays the mandatory check-in for MySejahtera is no more implemented in our country. But if you are COVID-19, if you want to know any new news updates regarding COVID-19, you also can get the info from MySejahtera application. So after reporting yourself to MySejahtera, you need to isolate, obviously. Isolate yourself from the community if you are COVID-19 positive, right? To reduce the risk of transmission among the community for COVID-19. As well, you need to inform your close contacts to do the test. This is several components of trees, and eventually the last one is seek treatment. Medical attention if you develop any severe COVID-19 symptom, if you are starting to develop shortness of breath or prolonged fever. please immediately go to nearest health clinics, all of the government health clinics, to seek medical attention for further treatment.
Absolutely.
This is the strategies of TRAXX that are always being mentioned by Ministry of Health regarding the self-empowerment of COVID-19 prevention and control in our country.
All right, doctor. Thank you so much for that. If they are at home, are there any medications that they should have with them?
Okay, as we all know, COVID-19 is a viral infection. If you are at home, meaning that you are having mild symptoms, if you develop any severe symptom, definitely you need to go to the nearest health clinics for medical attention. If you are mild symptom, you are only having mild flu, you can stand by certain medications and these certain medication you can buy yourself over the counter in the nearest pharmacies. You also can get consultation from the pharmacist regarding the medication. You need to stand by medication like paracetamol or anti-flu medication and all sort of that medication to alleviate your symptoms at home.
Yeah, just to manage the symptoms, right?
Yes.
Okay. All right, doctor, how about vaccines? Could you let us know a bit more about that?
Okay, for vaccine COVID-19, always bear in mind that vaccine is not 100% prevent you from getting COVID-19. If you are already completed your vaccination of COVID-19, still comply with SOP.
Definitely.
The SOP compliance is one of the important components for prevention and control of COVID-19 from getting to yourself. And then vaccine surely can reduce the risk of getting severe disease. If you are high risk, especially high risk group, as I mentioned earlier, please get vaccinated if you are not yet getting your vaccine. And there are several type of vaccine in our country, but now Ministry of Health provide Pfizer, the brand, for booster. For first booster and the second booster. And now also currently the Ministry of Health also already implement the second booster for COVID-19 vaccine, and this second booster applicable to all the high-risk group individuals out there. 18 years old and above, high-risk group individuals, also elderly people, 50 years old and above. If they are afraid of themselves getting severe disease, they also can get COVID-19 second booster vaccination.
Absolutely.
And I just want to emphasize regarding the booster, it's based on the statistic from KKM, the booster rate, booster mean that the first booster of COVID-19 vaccination among adults is quite low. It's less than 50%. Even though the vaccination coverage up to second dose is almost 100%, but the booster dose is still low. So please, people out there, we are facing the new variant of COVID-19 with much possibilities. Please get vaccination if you are not yet getting your vaccines of COVID-19.
Definitely. Always, make sure that you have your vaccines in check all the time. Now, doctor, is there a new variant that is causing the rise in the cases?
As announced by our YB Minister, YBKJ, recently, our country already recorded the new variant of COVID-19. And the name of the variant is the sub-variant of Omicron, BA.5. It is actually the sub-variant from the previous aggressive variant Omicron. And then based on his announcement in the recent PC press conference, this variant Omicron, we are still uncertainty regarding the severity of the disease, but based on the current data of MOH, the COVID-19 cases in our country is still under control. But we are still, ministry still closely monitored this new variant because we don't want this variant cause a bad effects, devastated effects to our country for COVID-19.
All right, definitely. Okay, doctor, what we're going to do is we're going to take another song break, and once we come back, there's still a couple more questions that we're going to be looking at, so don't go anywhere. Yeah, doctor, just stay on the line.
All right, thank you.
All right, that was Dr. Wan Muhammad Zainol Zakaria, the Principal Assistant Director with the Division of Disease Control, Ministry of Health. Don't go anywhere. We've got a couple of songs coming your way. Justin Timberlake's What Goes Around, right there on TRAXXfm. You are currently with us on Health on Tracks. We are talking to Dr. Wan on the topic of beware. COVID-19 is still out there, and he is the Principal Assistant Director with the Division of Disease Control, Ministry of Health. And we've spoken quite a bit about COVID-19 and its effects currently. Doctor, how can we avoid this harmful disease?
Okay, KG, with the emergence of many harmful diseases, because recently we are also being announced with the emergence of monkeypox, influenza A, FND, and so on. Yes. So the key of prevention of this harmful disease is obviously self-empowerment, personal hygiene. So you need to take care of yourself very well, take care of hygiene very well. Always wear your face mask, even though the situation of SOP is quite relaxed compared to the previous years. If you can see, during the previous time, during the early time of COVID-19, the government is very aggressive regarding the prevention and control with the implementation of MCO. We know that the effect of MCO is quite devastated, especially to the socio-economic. So we don't want that to be happen again. A lot of people lost their work during that time.
Yes,
business shut down because of this impact. So we need to practice self-hygiene. Always wear your face mask, always wash your hands, and always avoid crowded or confined space if you can. And obviously, just take care of your hygiene very well. Practice self-hygiene very well.
So most of the protocols that were in play during the MCO still can help us now, right?
Yes, and don't always remember, do not be complacent towards the spread of COVID-19, because the spread of COVID-19 is still rampant at the moment. Always remember that COVID-19 is still out there. Always comply with your SOP, even though the situation is quite relaxed. But self-empowerment, the key is self-empowerment. To comply with SOP.
Absolutely, doctor. And some people believe that if they already had COVID-19 once, they won't get it again, but they can still get it, right?
Yeah, I just want to remind out there, with the emergence of this new variant, we're still under close monitoring, but the rate of reinfection means that even though you have been infected with COVID-19, there is still a chance, even though you are fully vaccinated. But the severity of the disease is still under monitoring.
Okay. All right, doctor, what is your advice to our listeners?
So my advice is comply with your SOP, practice self-hygiene very well, and if you are COVID-19 positive at home, please monitor your symptoms. Always update your health assessment tools through your MySejahtera. You have any severe symptoms like shortness of breath and prolonged fever, please seek medical attention immediately, because now most of the health clinics provide the assessment for COVID. And always remember, get COVID-19 vaccination if you are still not get your vaccine yet, especially if you are high risk groups.
Definitely, doctor. All right, doctor, with that, it's a big thank you from all of us on TRAXX for making sure that we still and also from our listeners to making sure that we still understand exactly how severe COVID-19 can be and how severe it still is in our current environment. Thank you so much, doctor, for taking the time.
Welcome, TRAXXfm.
All right, have a good day, doctor. Bye-bye.
Okay, thank you.
And that was Dr. Wan Mohammad Zainol Zakaria, who's the Principal Assistant Director, the Division of Disease Control, Ministry of Health. We talked about beware, COVID-19 still out there. And guys, that is not clickbait or scare tactics, because COVID-19 is definitely still out there wreaking havoc. So make sure that you guys take all the precautions, all the necessary steps to keep yourself safe, as well as your family and friends safe as well. It is Health on Tracks right now, and it is now done. We are getting on back with the music as it is. I will see you guys in the next hour.